it's Casey here, GP and founder at MBSPro. I want to go through a couple of things that I keep track of at my clinics with the help of MBSPro that I think is really important from the context of a practice ownership point of view. So there's a couple of metrics really important for practice managers, practice owners, even receptionist nurses to keep a track of. So metric number one that we keep an eye on is revenue per consult. You might have heard this as revenue per encounter or revenue per appointment. Essentially, it's how much does each block of consulting time that you would offer as a standard appointment, how much is it worth? For example, if your appointments are based on 15-minute appointments, you might do 4 an hour for a standard GP appointment book, and you might charge, say, $100. So your revenue per encounter, provided you were full, would be $100. Pretty straightforward. What becomes a little bit trickier to track is if you do care plans, health assessments, you might have appointments that don't exactly run for, say, the 6 minutes or the level B minimum, or you might have health assessments and things like that. So you'll have a mix of item numbers that you're billing. So this overall item, or this overall percentage or metric that you're tracking being revenue per encounter, I think is really important. It's a measure of how full you are, a measure of how many care plans or chronic disease type items you're doing, health assessments, medication reviews, etc. And I think that's a relatively easy one to keep track of as like a single number. The other one that I think is not bad, which is kind of like a derivative of this metric one, is your billing efficiency. So it's how much or how many of those CDM item numbers are you using that each patient would be eligible for. So an example of this might be a patient that comes in and they're due for, say, like their care plan, they're due for their health assessment, their medication review. You may not do all those things at once, right? Because that might be a big appointment, they've just booked in for 15 minutes. So you might do 1 or 2 of those things. And if they were due for 3 and you've done 2, you might say you have a billing efficiency of, say, 66%. It's a made up number. It doesn't really mean anything by itself. It's just something that you might track, like how often are you using all of those item numbers. Now, that leads into my second metric that I think is really important to track in terms of growth and helping with that revenue per encounter is your CDM percentage, or your CDM revenue as a total percentage, as a percentage of your total billing. For example, you might do plans, health assessments, and medication reviews. That's what I would classify as CDM, so chronic disease item numbers. And how much do they contribute to your overall billing? The reason why you might want to track this is we know that the general population probably has about 50% chronic disease prevalence, and therefore it would make sense that your care planning rate probably approaches that. In all the clinics that I've seen, it's actually pretty rare to get it above about 20%. If you're doing 20%, that's like fantastic. Some of the clinics that I work closely with, it can be as low as a couple of percentage, and as high as 15 to 20% is sort of the highest that I've seen. I've heard of clinics doing 25% above, and I think, wow, that is fantastic. I think care plans are a great opportunity to see your patients, see them regularly, ensure that they've got all their vaccines, preventative care items due. I think it's a really important item number. So this is something that you can track to see, are we doing the best by our patients? Because you'd find probably 50% of your patients need some sort of chronic disease item number to be billed. Now, metric 3 is kind of derivative of that, which is your health assessment capture rate. Essentially, of your health assessments are you actually capturing? Now, the reason why I focus on health assessments as opposed to care plans is the changes to care plans being the 965, 967, specifically being GP chronic condition management plan, you'll find that a ton of patients are eligible for these. What we've done in the clinics that we've worked with, or the clinics that I own, is we've moved from a nurse-led care planning structure to health assessments being nurse-led. The reason being is that I think that care plans can be done really quickly with AI, like MBSPro, or any of your other favorite AI tools, whereas health assessments have a time requirement, and therefore having a nurse contribute towards that time requirement makes a lot of sense. As care plans have become more GP-led, I think that health assessment capture rate is an important metric to capture, to look at. There are now 10 different types of health assessments. So you've got your age-based ones, Indigenous, 715, you've got your 699, your 695, there's a couple of DVA ones, there's intellectual disability, so on and so forth. So there's a ton of different types of health assessments, and you'll find that a lot of your patients are due for health assessments at one point in time or another.